And I have really been looking forward to this discussion that was brought to me by Sonia Gao with the Inova Parkinson's and Movement Disorder Center. And I'd love to welcome, there's Sonia, and let's welcome Dr. Falconer to the stage, who is going to be our primary host today. But both Sonia and Dr. Falconer, we've never done a discussion specifically on rehab in our series, but I don't think there is one discussion that we have on an aging related topic where rehab doesn't come into the dialogue, because so many of us, we start this journey in elder care with an accidental fall or a visit to the hospital, and then that leads to some form of rehab. And now all of a sudden we find ourselves in this elder care system. So I think today's discussion is going to be very important.
I do too. Thank you, Steve. And thank you to everybody who's joined us today on the attendee side, as well as the panelist side. Everybody, we have just an amazing array of talent here that's going to help lead a discussion for the next hour. And this presentation came about exactly for what Steve mentioned. And all the credit, of course, as always, goes to the great Sonia Gao, who is to my left in the Hollywood squares of our teleconference today. And this really came about because, I mean, we all, and I'm looking at the attendee list, we have a lot of patients, we have a lot of care partners, we have a lot of folks from our community of support. And it's an important message to remember that at the end of the day, every person who is living with Parkinson's and every person who is within that bubble of a person living with Parkinson's are trying to live there every day. Look, this was a beautiful weekend on Sunday. It was rainy on Saturday. It's summertime. We should be all out there doing the things we love. And for a lot of folks, we aren't. And the important thing that I want folks to get from today is not only that we all need to take control of our lives and understand that good enough is never good enough, but at the same time realize that there are unbelievable resources out there to try to set the ship straight when sometimes we steer off course, right? And so that's what we're going to try to do today, is have a good discussion amongst all of our different rehabilitation specialists, because I really want, if you're living with Parkinson's, if you're living with someone who's dealing with a movement disorder, if you're in senior living, if you're in community engagement, whatever your role is, you have a place in someone's life that is dealing with a chronic disease. And whether you're living with it or surrounding that person, every time you meet with them, just don't forget that it's a touch point. It's a moment of possible intervention. It's a moment to strike up a conversation with how are you doing? How is your day? How are the things you want to do, and can you do them? Because every time we meet or talk with somebody, that's a moment where we can say, hey, if things are slipping, now is the time to get back into things and get back specifically into rehabilitation. I was saying in the warm-up, and I meant every word of it, that, look, we see patients clinically once every 3 to 6 months. In between those 3 to 6 months, life isn't on pause. Life is rolling at its own pace. And it's the folks in rehabilitation who are seeing folks 2-3 times a week, once a week, and all the different support around these patients that really gives us the ability to help course correct as time goes on. And so what I want to do today is really let our rehab folks speak for themselves, obviously, because they're all heroes of mine with the amazing work they do. Because I really want folks who are out there to realize that there really is a difference between PT, OT, and speech. A lot of folks can get them mixed up. So I hope we can clear that up today. And then introduce you to all of the different resources that we have within the Inova Health system, so that if you work with patients with Parkinson's, live with, or are, that you can realize that there are resources nearby that really are out there doing God's work and turn people around. So with that, this is not about me. I'm going to be here behind the scenes. Steve's going to help guide things as we go. Please, if you're an attendee, throw questions into the chat or the Q&A. Steve will jump on and throw them at our panelist. But without further ado, I want to pass it over to Monica, who's going to start us off today. And the journey will go where the journey goes. This is going to be fantastic. I'm really excited for the conversation we're going to have. Hi, Monica.
Morning, everybody. Thank you, Dr. Falconer. So I'll preface with, if there's any interruptions, the only one it's going to be is that our therapist dog might be coming back from his last session and knocking on the door.
Ooh, I hope we get to meet the therapist dog before the day is over.
There's a good chance he'll come this way. So I'm going to share my screen.
All right, looks good.
How's that?
That looks good.
Good. All right, so I am presenting on behalf of all of the outpatient rehab centers across Inova. On here, we have both managers, directors, therapists, particularly therapists that are specialized in Parkinson's disease, movement disorders, as well as a wide variety of other adult population diagnoses that may bring you to therapy, whether it be an injury, an illness, or a disease. So I just wanted to start off with showing these are the 5 Inova hospitals in the health system. We also have Inova physical therapy centers. We have 29 Inova physical therapy centers outside of the hospital-based rehab, and those are scattered among this region as well. But in regards to neurotherapy, specifically if somebody was diagnosed with Parkinson's or another movement disorder, you'd be looking at Inova Alexandria, Inova Fairfax, Inova Fair Oaks, Inova Loudoun, and Inova Mount Vernon. And really, we all work together as one team and try to streamline things so that you have access, regardless of where you live in the Northern Virginia area, to the care that you need. The website on the bottom is the best way to look a little bit deeper into our services. There's a wide variety of diagnoses that we treat. A lot of people don't even recognize that therapy is beneficial for some of these diagnoses. So I just want to go through and discuss that at each of these care sites, we have specialized therapists frequently with various different types of certifications, advanced degrees in treating these different patient populations. And a lot of our therapists really do specialize and hone in on their careers in caring for people with these diagnoses. So amputations, brain injuries, that's mild, moderate, or severe brain injuries, concussion, developmental disorders, dysphagia or difficulty swallowing, fall risk. So you don't have to have had a fall to come to therapy. If you're at risk for falls, a doctor can write a prescription for you to come to therapy. Lymphedema, multiple sclerosis, neurodegenerative diseases, neurological disorders, oncology or cancer, orthopedic and sports injuries, Parkinson's disease, both men's and women's pelvic floor therapy, and that's for bowel and bladder function. And then a couple more unique clinics, postural orthostatic tachycardia syndrome. We now have a post-COVID recovery care center, post-ICU syndrome, also known as PICS, spinal cord injury, stroke, vestibular disorders, and voice disorders. All of these, most of these diagnoses are treated at all of the hospitals, but you certainly have to ask when calling to make sure that there are therapists present that specialize in these areas. So I'm going to talk about each of the different therapies and what makes them unique, why you might go to a certain therapy versus another therapy, how they're similar, how they're different, and what you can get out of each type of therapy. So for physical therapy, therapists work on balance training. They work on gait analysis and training. So that's walking, strengthening, range of motion, motor control and coordination, transfer training. So that's getting in and out of bed, getting in and out of a wheelchair, a car, on and off the floor. Vestibular therapy is dizziness or your inner ear. Vestibular therapy can both be for brain injuries, brain disorders, or as well as more someone that you would think to go to an ENT for when it's your inner ear area. Activities of daily living, so just trying to get you back onto your feet and doing the things that you love most. We have wheelchair seating and mobility clinics across the health system. We have orthotics and prosthetics clinics across the health system. An assistive technology clinic, so helping people use assistive technology to access their environments and their homes. Aquatic therapy is currently on hold at most sites due to the pandemic, but we're looking to build up aquatic therapy again. And then of course, LSVT, the big Parkinson's program for physical therapists, women's and men's health and pelvic floor, bowel and bladder function, return to work programs, community reintegration programs, and home management skills. The next is occupational therapy. So this is some of our occupational therapists. You may come to occupational therapy again for all of those diagnoses that we listed earlier on. But what an occupational therapist does is they also work on strength and range of motion. They may specialize with people with hemiplegia, which means that half of your body is weaker than your baseline. Paraplegia, where your lower body is weaker or fully paralyzed. And quadriplegia, which means your arms and legs are weaker. Motor control and coordination, activities of daily living like brushing your teeth, going to the bathroom, taking a shower, getting dressed, cooking a meal, also work, typing on a computer, managing your bank account via computer, things like that. Occupational therapists can work on bowel and bladder function. They work on different home management skills like vacuuming, raking, mowing the lawn, folding laundry, taking laundry up and down the stairs. They also help work with return to work. They can help you with specific work-related goals, whether it's working on Excel sheets, working 2 screens at one time, focusing on a task while somebody's talking to you, while the phone is ringing, while there's somebody else on a Zoom call behind you. Community reintegration, so getting back into society, going shopping, going to the library, going to the different areas that you go in your community. A lot of occupational therapists are certified in vision therapy, and so they can help you to improve your vision, whether it's based on a neurological disorder or other disease or illnesses. They can work on handwriting and computer. I kind of touched on some of these, but they work on basic life skills like banking, medication management, and cooking. And then occupational therapists can also be certified in the big Parkinson's program, LSVT. And we also have occupational therapists that are certified assistive technology professionals. Workstation adaptation, so improving your ergonomics to reduce pain. Maybe your mouse isn't in the right place, your keyboard is not in the right place, or your screen is not at the right height. And then we also have several drivers rehab programs across Inova to help people to get back on the road again, or vice versa, recognize when it is time to hang up the keys and graduate on a high note. Third, we have speech language pathologists. So different areas of speech language pathology. I think a lot of people have the connotation that you go to a speech therapist if you're having just trouble talking, but there's a lot of other things that speech therapists do. I have this in alphabetical order. But alternative and augmentative communication. So these are devices that if you are having trouble talking, these are compensatory strategies to help you to communicate with others, your basic needs, as well as higher level communication skills. Apraxia is speech, so difficulty getting the words out and formulating the words properly that you want to say. Cognitive deficits is more about problem solving, memory, dual task, dividing attention, multitasking. Expressive and receptive language. So expressive is your ability to vocalize the words that you are thinking. So somebody may be able to think perfectly and process perfectly, but they might not be able to get the words out. Versus receptive language, which is not quite understanding what other people are saying you. So you might be able to talk and talk and talk and talk, but you're not fully able to comprehend what other people are explaining to you. Then the LSVT Loud Parkinson's program. So speech therapists are certified in Loud for the Parkinson's program. I'll have slides specifically on LSVT coming up shortly. Our speech language pathologists also work in our post-concussive clinic. So patients who have had a concussion and aren't necessarily recovering at their own speed, which is typically within 30 days, may need additional help from a speech language pathologist. SLPs also work on dysphagia or swallowing and have various different types of techniques and tools to help with swallowing, both assessment as well as treatment. Vocal cord dysfunction is a really unique population that our speech therapists work on to help people with their respiratory strength and timing and management of their vocal cords with respiration and talking to get people back to their normal function in communication. and then voice disorders. So there's a wide variety of reasons why people might actually need true voice therapy and getting their voice back again. So going forward, we're going to go through specific different types of specialty clinics that Inova Outpatient Rehab offers. And of course, we'll start with our Parkinson's LSVT Big and Loud program. So this is an example of a patient in our therapy clinic doing big therapy. And what big therapy is it's high intensity, amplitude-based exercise program for the motor system. And it's really all driven by neuroplasticity. And what neuroplasticity is it's about the amount of force you're using, the intensive practice. So lots of practice, lots of frequency, challenging tasks. So you have to do something that's outside of your capabilities. That's just a little bit harder to be able to create neuroplasticity and improve your brain function. The repetition of these tasks, and then feedback to your system for proper learning. And there's three main goals of Big and Loud. So it basically is replicating what I just said. The first one is to bombard the peripheral motor system through physical exercise and sensory motor stimulation. The next one is to bombard the central nervous system by driving the basal ganglia circuitry for planning amplitude. And then the third is to bombard the emotional system to enhance motivation, attention, confidence, and self-concept. And there's extensive evidence that if you really target and really hit these three symptoms, that you'll have long-lasting effects. So the protocol for LSVT, which is Lee Silverman voice therapy, Big and Loud, is that it's typically 1 month and it's 4 times a week. So 4 days every week that you're coming into therapy and getting these services for an hour and really focusing on these. And then you get homework, and we have lots of graduation classes or refresher classes that you can continue weekly once you've graduated from this program. And here's a slide on our physician counterparts from the Movement Disorders Clinic. You just saw Dr. Falconer speak. And this team is really incredible. It's been really a wonderful program where we have doctors and therapists coming together to treat the whole patient and collaborate and talk about what they're seeing. And if in therapy, a therapist is identifying an area that might need an additional attention or focus, and they can reach directly out to the doctors, and maybe the doctors are looking at medical management or these various cutting edge treatments like deep brain stimulation, or Botox injections, things like that. So it's really a great team to come together and treat the whole person throughout their lifespan. This is just a fun picture from 2018 pre-pandemic when we were all at the Walk Off Parkinson's, which is an annual event. So now I'm going to go through each of our different specialty clinics. Here's our concussion clinic. I'm not going to go into quite as much detail as I did with the Parkinson's program, but this is a clinic that if you call after concussion, we typically get you in within 2 to 3 days to do a lot of education and training on how to prevent any worsening symptoms and get people back to school or work as quick as possible. Our wheelchair seating and mobility clinic. So people come here for wheelchairs, strollers, activity chairs, car seats, gait trainers, patient lifts like Hoyer lifts, bathing and showering equipment, as well as smart technology for the home and workplace. So accessing their computer or light switches or temperature controls or different video remote monitoring for the front door. Orthotics and prosthetics clinic. So orthotics is bracing for people who need braces, and prosthetics are prosthetic arms or legs for amputees. So we do upper and lower body, and we work closely with several different orthotists and prosthetists in the area. And our Inova physiatrists are part of this clinic as well, with helping to determine what's the most appropriate brace or prosthesis for patients. And then we continue to see people for education in walking, mobility, transfers, going up and down the stairs, getting on and off the ground, going to the beach, going to the store, going to the bathroom, all sorts of different things. We have several different lymphedema clinics across the health system. I have two here. Two here are listed for Loudoun, but we have several different lymphedema therapists across the entire system that work on both upper body and lower body. And it's a really wide variety of services that will bring people to lymphedema therapy, potentially lymphatic insufficiency, venous insufficiency, transient edema. We see people before and after breast cancer treatments. We see people before and after several other, like head and neck cancer. We will see people before and after. And then we also work closely with our wound care center. Vestibular therapy. So like I mentioned in the beginning, we see people with both peripheral and central vestibular disorders. And some of the things that we specifically do with our patients is gaze stability. So the ability to focus your eyes on the object that you're trying to look at. Postural stability, so controlling your entire body, your balance, your coordination, vertigo or dizziness, and then visual and vestibular sensitivity. So people might be hypersensitive to different things, kind of like in this picture here, where we have somebody trying to focus their eyes on the bee while there's a very stimulating background and on an unstable surface. And then once we're working on these different vestibular deficits, helping people to get back to their activities of daily living. We have a large fall prevention program. This is our team pretending to fall and catch people. So I won't go into too many details. We have a community presentation that we often give. We go to different senior centers and different evening presentations where we go and assess people for their fall risk and really just alert people to the risk for falling and how detrimental it can be if it were to happen. And that there's so many different modifiable behaviors that you can change to reduce your risk for falling. But in our fall prevention clinic, if someone was to come here saying I may be at risk for falling, we work on gait or walking, strengthening, balance. We take a look at medications. As therapists, it's out of our scope of practice to really discuss medications, but we can identify if there's medications on your medication list that put you at increased risk for fall and just suggest that you talk to your doctor. We can review and educate on different home hazards like area rugs that aren't secured to the ground or low lighting and recommendations for night lights, decluttering the home, things like that. Measuring orthostatic blood pressure. A lot of falls are related to standing up and becoming lightheaded. So again, referring back to the doctor to help manage that. Making sure that you get an annual eye exam and checking visual acuity. We assess people's feet and their shoe wear to make sure a lot of people have reduced sensation or reduced feeling in their feet. So we can address that and making sure people are wearing proper footwear. Discussing with your doctor the appropriate amount of vitamin D intake and any other comorbidities that may increase people's risk for falls. The next area is pelvic floor therapy. So we have several different pelvic floor specialists across Inova, and there's a wide variety of different diagnoses that may bring people to pelvic floor therapy. We're really trying to get the word out that a lot of the symptoms that people just think that they have to live with for the rest of their life, they don't have to. And also getting people into therapy before they go the surgical route. Obviously, surgery is required sometimes, but I would strongly recommend everyone going to a pelvic floor therapist before they go that route. And also really educating the public in, I mean, I've had 3 children. I think that everyone after having a child should see a pelvic floor therapist to strengthen their muscles and get back to the body that they had previously and not have to live with some of the symptoms that a lot of women struggle with for the rest of their life. The post-ICU recovery clinic, this is very similar to now what is our post-COVID clinic. So people who have been in the ICU have a much more risk of delirium, dementia, cognitive deficit, as well as anxiety, depression, post-traumatic stress disorder. And the people I'm talking about are frequently in the ICU for potentially pneumonia, congestive heart failure. So it's not something that would directly make you think to come to therapy, but then they acquire all of these other symptoms: difficulty breathing, difficulty walking, pain and numbness. And so all of our PTs, our OTs, and STs are trained to help people with this and try and get people back to the life that they were living prior to their ICU experience. Again, very similar here is the post-COVID recovery clinic. So this is not only for people who have been hospitalized or potentially on ventilators or ECMO, but we also see a lot of patients in our post-COVID clinic that, you know, just tested at home and never even went to the hospital, but are still dealing with what's called long COVID or post-COVID syndrome. That people are having these difficulties and they're not able to return to work, or they're not able to return to work at the same level that they were before. So our team comes together and really helps them identify where their areas of deficit are and work with them to improve their symptoms. So those are the specialty clinics. We just have a couple other slides. This is a slide about our clinic precautions for safety. You know, fortunately, being hospital-based, we are already very well educated and, you know, confident in our skills for mitigating the risk of transmission of infectious disease. So we're washing our hands before and after every patient contact. We're wiping down every piece of equipment. These are all things that we've always done. We're still wearing masks in every clinic. We're consciously always trying to still keep people spread apart, minimizing visitors in the waiting room. We only have visitors or family members that are medically necessary or for parental guidance that are coming back to therapy, or if it's necessary for the treatment plan, right? Like learning how to safely guard your loved one or help somebody in and out of the car, or help someone up and down the stairs, things like that. Here's just some fun pictures of our teams across the health system. Here's a slide on if you were interested in therapy, what you need to attend therapy. We ask that everyone has a prescription in order to come be evaluated for therapy. And on that prescription is the patient name, date of birth, the current date, the medical diagnosis, and then depending on what you need, PT, OT, or ST evaluation and treatment. If it's an Inova doctor, like our movement disorders doctors, they can do all of this just within our electronic medical documentation system. And here again is all of our sites. And one of my favorite quotes, medicine adds years to your life, but therapy adds life to your years. Thank you.
Wow, this was great, Monica. What a great overview. And now we've got the opportunity to meet some of the team members that you've got, correct?
Absolutely.
And I just want to remind the audience, if you have any or all questions, comments, what have you, related to Monica or any of the team members that we're about to meet, or just related to therapy in general and the transition from the hospital to therapy, questions like that. And I know there's a lot of providers. You've got clients who are going through these transitions. This is your opportunity to really tap into the knowledge, great knowledge base in this area. So let's see. How do you want to do this, Monica? Do you want them all to come on, or would you like them to sort of come one at a time?
Yeah, I think it'd be great if everyone wants to show their faces.
Okay, great. And what we can do is sort of go, I'm going to take my face off the screen here. What we can do is sort of just go around the little Brady Bunch square here. And oh boy, the first one on my screen, I botched her name when we started, Shralika.
Yeah.
Um,
Steve, you got it.
oh, awesome.
Thank you all. Monica did a fantastic job talking about each of our services. In particular about Alexandria, I represent Alexandria Hospital. I'm the rehab director and a PT by background. I do have LSVT certification myself. First and foremost, we are open from 7 to close to 5:30. So we are open to giving early morning appointments or late afternoon appointments. We have 4 physical therapists that are trained in LSVT, and we have 2 OTs that are trained in LSVT, and have 3 speech language pathologists. We do have, we try our best to provide appointment within a week of your calling. If you have any other questions, I'll be around to answer them. Thank you.
Great. Okay. And then it looks like we've got Katie Reynolds next.
Hi, everyone. My name's Katie. I'm one of the occupational therapists over at Inova Mount Vernon. I am also LSVT BIG certified. So we work in conjunction with PT to provide LSVT services here at Inova Mount Vernon. We are just, there's a couple other clinicians from Inova Mount Vernon who will pop up too, but we are 8 to 4:30. For our clinic hours as well. And we've got on site here to some of those specialty clinics that Monica had done a really good job of talking about as well, including wheelchair and prosthetics as well.
Great. And then I think Amy, you're next on my list.
Okay, good afternoon, everyone. My name is Amy Morgenthal. I'm an occupational therapist at Inova Loudoun Hospital. I'm also an LSVT BIG certified clinician. In addition, I also lead a LSVT BIG graduate class. Right now, we're meeting virtually. In the past, we have met in person. And like others have shared, Monica did a fantastic job describing the services that we offer. So if anyone has any questions for me, specifically about occupational therapy services or the LSVT BIG program, I'd be happy to answer.
Great. And then Jill, you're next. And I just wanted folks to know I dropped the PowerPoint because there was a couple of slides that people wanted to see again in there, and I put the emails for our panel members in case you'd like to follow up with them later.
Hi, everyone. I'm Jill Fitzgerald. I'm a senior speech language pathologist at Inova Fairfax Hospital. I am LSVT Loud certified, and I also conduct modified barium swallow studies to evaluate swallow function. We have that within our hospital as well. Outside of direct one-on-one therapy, I host the National Parkinson's Foundation Communication Club weekly on campus here at Fairfax.
Great. And it looks like Margie's next.
Hello, everyone. I'm Margie Comerford, speech language pathologist over here at Inova Loudoun Hospital. I'm going to sound redundant from what Jill just said. We do have modified barium swallow studies here. We work with our inpatient team to do outpatient swallow studies. And we also have fibroendoscopic evaluation of swallow, which does not require radiation to complete. I also lead the communication club here at Inova Loudoun Hospital. We're meeting by Zoom as well, hoping to return to person as soon as possible.
Okay, and then we've got Lauren.
Hi, everyone. I'm Lauren Viola. I'm one of the speech language pathologists at Inova Mount Vernon. Similar to what Margie and Jill said, they're able to offer at their hospital. We also do modified barium swallow studies and FEES swallow studies here as well. We are LSVT Loud certified and offer those services. And my coworker here, Katie Holtzman, if Steve, if it's okay if I can tag her really quickly, got us a really wonderful grant a few months ago for us both to get trained in the Speak Out protocol. So I will let her talk a little bit about that grant and that program that we are now able to offer here as well.
Yeah, let's jump the line here. And Katie, if you want to be the next one, and then we'll finish with Lisa, Sharon, and Smitha.
Sure. So I'm Katie Holtzman, and I'm also a speech language pathologist at Inova Mount Vernon Hospital. And as Lauren said, we recently applied to receive a grant from the Parkinson Voice Foundation for their Speak Out program, which is just another tool in our toolbox for Parkinson patients. And it's similar in ways to the LSVT program, but the program is not as intense. The requirement for the first 2 weeks is 3 times a week, and then it drops down to twice a week. So we were struggling with some patients just not being able to get here 4 times a week. So we're hoping that this will help some of those patients be able to receive treatment at a less intense schedule. And I also specialize in voice therapy. So that is one of the treatments that I also provide here at Inova Mount Vernon.
Great. And then to Lisa.
Good afternoon. My name is Lisa Nihill. I'm a physical therapist at Inova Fairfax Medical Campus. Our outpatient team is currently located actually across the street from the hospital at anyone who's familiar with the Northern Virginia area, the old Exxon Mobil building. It's become a large secondary or second campus within Inova Fairfax Hospital. Our outpatient team, I myself am LSVT certified, and also one of my colleague OTs is LSVT certified, which is a nice combination for people sometimes to get two people working on one case, because it's generally the program is 4 days a week. And so sometimes you can get different perspectives having the two different therapists working, which is a nice change at times. Our speech therapists currently are mostly due to, unfortunately, time constraints and patients as well not being able to come in the 4 times a week. They are not providing the LSVT loud, but they use elements of that and also the Speak Out program to focus on compensatory strategies for their voice and the loudness and the quality. So yeah, that is our program. And anything else?
I'm Laura. I'm the outpatient clinical manager for the Inova Fairfax Medical Campus Rehab Services. And I'd say also, like our other hospital counterparts, we also offer modified barium swallows here on the campus, as well as a number of other programs.
Great. And our last panel member, but because we're finishing up here with Sharon and Smith, I want the audience to start throwing any questions that you might have for this great panel into the Q&A. But Sharon and Smitha.
Hi, yeah, I'm Sharon Gaskin. I am LSVT certified occupational therapist at Inova Fairfax Hospital. And just to piggyback on what the last person said, as far as OT and PT as a team, Smitha is a PT, she'll introduce herself, but I think we've found that combination is really helpful when we kind of share a patient. We had someone recently who was very high level balance, but had lots of more fine motor and those kind of issues. So we were able to bring OT into that, but share the patient through his 4 days. So I think that's, a really lovely thing. And I'm sure that's happening in lots of places, but.
I'm Smitha. I'm LSVT certified. I'm one of the physical therapists here at Fair Oaks Hospital. One thing we love about the LSVT program is you can really customize it for whatever your issues are. And so you are the one who drives the exercise program, and we use our creativity and try to address whatever is your issue, which will be different from person to person. Another thing that we do offer at this clinic is once you're done with the LSVT program, then what next? And my colleague and I, we actually have exercise classes 3 times a week. 2 are in person and 2 are, and 1 is online, and 2 classes are associated with the Parkinson's Foundation. But it is a 1-hour exercise class with weight training, balance training, and a whole lot of fun ways to get your heart rate up. And yeah, so that's between my colleague and me, that's 3 times a week. And so, and these classes pertain specifically for those with Parkinson's. So we address issues that people with Parkinson's struggle with, as opposed to a regular exercise class.
Great. All right. Well, this was an amazing overview, and it's great to sort of see the faces that are oftentimes you all are working so hard. It's hard to see on online meetings and get an appointment with you, and so using this platform to meet you all is fantastic. I think. And the Inova Parkinson's and Movement Disorder brought this together, but obviously you all are getting clients and patients who are discharged for a variety of reasons. It could be a fall, it could be you know, any aphasia, things of that nature. If you could and it doesn't need to be all of you, but if one of you could sort of wave a magic wand at some of the challenging things that you've seen people do when they get that prescription that says you need a therapy, what are some of the things that you wish that every patient did that oftentimes they're not doing when they get that assignment?
If I may jump in. And actually that piggybacked on something I was just thinking about before. I don't recall, and if this is repetitive, I apologize, but I think one of the big things for people to understand is the LSVT big and loud programs are wonderful, wonderful programs, but they're not the only thing out there. For one, there is also, there's what I would term as more traditional therapy. It might be that somebody can't come 4 days a week. The requirement for LSVT big is 4 days a week for an hour with a therapist, and then also doing the additional exercises at home to the point that it's 14 sessions of therapy, either by themselves or with a therapist a week. So some people are either not willing, able, or at this point when we see them really ready for that. So I think my magic wand is just trying to be able to explain. I truly appreciate when Dr. Falconer and all the other physicians refer someone for LSVT big, but then providing the education of really what therapy can provide, and that my magic wand, going back, is staying active. If it's not LSVT big, there's so many programs out there. There's boxing for Parkinson's, dancing for Parkinson's, cycling for Parkinson's. So the magic wand was whatever you liked to do before, let us know, because that's what we want to address. We want to have you enjoy the quality of your life doing the things that you want to do, not the things that we think you should do.
Yeah, and I've heard this before is that you don't need to walk this road alone. You need to communicate all of your wishes and dreams, because teams like this can make things reality that you never imagined when you get a specific diagnosis or you're recovering from a particular accident. Let's see. Okay. Doug asks, where is driver rehab offered? Somebody had mentioned driver rehab, I believe.
We currently have drivers rehab at both Inova Mount Vernon Hospital and Inova Loudoun Hospital.
Okay. And then Susan says, I had a hard time finding movement centers listed as my members of my insurance. How would I get this covered by insurance? Any thoughts on that?
Sonia or Dr. Falconer, if you want to jump in, but I would reach out to your insurance, looking at neurologists versus movement disorders. That's sort of the marketing specialty titles that we're using, so patients understand what they do, but their specialty is neurology.
And I'm really glad that Dr. Falconer popped back on the screen, because Ellen had a question, and it's what percentage of patients with Parkinson's or other movement disorders develop dementia?
So yeah, thank you everybody. I'm back. I had to jump off. We fit somebody in at lunchtime first, an emergent need, but this has been a great conversation. The question was about dementia. The numbers are a little mixed, really, because remember with Parkinson's disease, if the average age of onset is 65, then as somebody is going through that journey with Parkinson's, we're dealing both with Parkinson's as well as age. And cognitive issues can be part of the natural aging process as much as they are a product of a disorder like Parkinson's disease. And so because of that, the numbers are a little mixed. Some studies say anywhere from 15 to 20% of patients with Parkinson's develop cognitive issues. Some studies say it's as high as 50%. But again, those numbers don't freak out about. They really take into account also the natural cognitive changes that happen with age too. And if no one has mentioned it so far, don't forget, everybody, that speech therapists are also cognitive therapists and do an absolutely fantastic job of rehabilitating memory and that sort of thing. Because just like speech is a muscle problem, and we need to rehabilitate to strengthen speech, memory itself is kind of like a muscle. And so I find it's a very underutilized resource, and the speech therapists on this call are fantastic. And if I had a loved one with cognitive issues, I would get them in line with everyone on this call tomorrow.
And
Can I jump in, Steve, for a sec?
oh, absolutely, yeah.
I just wanted to say too that occupational therapists also address cognition. So when we're working with physical therapy with a patient, we can be kind of looking at those things. And because we're dealing with occupation, our approach is very adaptive. What can we do to make you function better, given maybe some cognitive changes that are, like you said, could be just normal aging and could be Parkinson's. Thank you.
And you know, oh, go ahead.
Steve, I'd just like to jump in too. A lot of times with our Parkinson's patients, we tend to think about how to jump ahead in terms of do some rehabilitation to strengthen before there's decline in terms of the voice. That's what LSVT can be used for. But the same thing can be true of cognition. We can train people, do baseline evaluations if they have fears of their cognition slipping as they progress through the process. And so we can also assess those things, occupational therapy and speech therapy, and get a baseline evaluation so that if there's changes, we have a comparison. And sometimes that can ease people's fears of their changes.
Just want to piggyback on Margie there, if that's okay. Not to take the speech therapy show, but I do appreciate all the compliments about speech therapy. I just want to, back to that magic wand question. I would love if individuals that got a script for speech therapy understood that speech therapy is not just speech therapy. Like Margie mentioned, it's voice, like Dr. Falconer mentioned, it is cognitive linguistic therapy. But a big hitter is the swallowing, which is dysphagia. And I read a statistic recently, 300,000 to 600,000 people in the US are affected by neurogenic dysphagia a year. So that's about 50,000 a year. So keeping, whether you're a patient with a movement disorder, or if you're a caregiver, keeping an eye out on nutrition and hydration and your ability for intake can affect the whole system. So know that a speech therapist title is deceiving. We see a lot.
Okay, great. Now I'm going to hit.
Can I jump in real quick and just say something that I think everyone out there needs to hear? And it's the most common thing that we hear clinically when we say, oh, you really need speech therapy, occupational or physical therapy. And the answer is always, oh, well, I did that last year, or I did that 3 years ago, or oh, I did that once, right? I tell folks all the time, this is a movement disorder. This is a movement category. We're all moving through life. Rehabilitation is very much like exercise in a way, where if you tell me you did Zumba 2 years ago, that doesn't really count much for now, right? It's maintenance, it's development, it's addressing needs now and adapting those needs as time goes on. If anybody on this who's attending has Parkinson's, a movement disorder, anything, you should be being evaluated and doing a full rehabilitation gamut probably once a year. I would send people twice a year if insurance would allow it. But once we burn through those days, don't forget, there are ways that we can write letters to try to appeal for more maintenance programs and more access. But please, no one fall behind that idea that I did it once and that counts. That is not just not how it works.
And you know, well, Dana RN has her hand up, so I'm going to press that button to allow Dana to ask a question. But I also want to give a plug for occupational therapy, because I see Greg Sieb from Live in Place is in the audience. And one thing that always concerns me is when people are discharged from the hospital with some mobility issues, and now they go back home to a home that may not necessarily be safe and accessible. I know that occupational therapists play a valuable role in helping people through that. And I know when you're doing outpatient therapy, it's kind of hard to see the environment that these people are coming from. But do you give folks guidance in this area in terms of modifying and making their home a bit safer?
And get rid of your rugs.
Yeah, rugs. And Dana, I opened up the mic. Did you have a question?
I just want to say all of this information has been unbelievably helpful, and I like it. Specifically, I really prefer to send our residents, our senior residents that need PT, OT, speech therapy out to therapy, because we provide transportation for them to go from Walton Wood, Ashburn to the outpatient therapy departments, because it's a social engagement as well and more stimulation. And it's a different environment than they live in. And I think it's very helpful, but all of our residents have truly improved with this team. This is a fabulous team. Thank you.
Great. Thanks, Dana. And let's see. Okay, we got a few more minutes. So whenever I say that, it's sort of like a couple more questions come in. But I say to the entire panel here, any sort of words of wisdom that might help folks that are either in the process of rehab or may have rehab in the future that you would like to share. And as Dana is from a senior living community, anything that you'd like to share with your partners in the home care senior living space in terms of working with your rehab teams?
Steve, if I may add, as Dr. Falconer said, we do what is called as tune-up sessions. It actually happens after completion of initial LSVT big program. Our therapists usually recommend 6 months to 1 year after. We sometimes do fewer than 16 visits depending upon patient needs. I'll post that information in the chat, but we call them as tune-up sessions, and we highly recommend patients to come back for those sessions.
Great. Oh, thanks. Boy, you're quick. Okay, so it's there. So I think we're winding up here. This has been an absolutely wonderful opportunity to just meet a ton of team members. Think about how many trips you would have to make in your car and buying bagels and donuts to do in-services to meet this many Inova team members. So I want to thank Sonia for putting this together, but Dr. Falconer, if you want to, or you and Sonia want to kind of have some closing statements.
Well, I have a question for the panel, and this is one that I would love everybody's response on, because it's summertime, it's beautiful outside. I'm spending every weekend with my kids, and I go to ice cream shops all the time. Thank you to my 4-year-old who loves ice cream. I would love to know everyone on the panel's go-to ice cream flavor. Like, what is your favorite? Somebody jump in there. I got to know. I'm taking a poll. Chocolate. We go chocolate. Okay.
Chocolate.
We're all just in No Rocky Road.
No, mocha chip.
Pistachio.
Coffee with chips.
Coffee.
Kids have gotten into mermaids, Superman, birthday cake.
Oh, Monica must have kids about my kids' age, because I live in the cotton candy. We always find the cotton candy ice cream, which shockingly tastes really like cotton candy. Lisa, I didn't hear from you. What's your go-to ice cream?
I know, I was the mocha.
Mocha chip. Yeah, that's good. Katie, did you throw a chocolate in there?
Which cake? Which one did
we have two Katies. I threw a mint chocolate chip in there.
Oh, there are two Katies. Sorry, I was looking into my left. Sorry, Katie. Okay, Holtzman, Katie.
I'm the pistachio.
Pistachio, yeah. Especially when you can find pistachio with like real pistachios in it.
Yes.
Whole different level. Yeah. My sometimes I'll do pralines and cream. I'm just throwing that out there. If you never had that, that's
Dr. Falconer, I think there's a bunch of people in the audience that are running to the grocery store to go get you your Sonia, you're going to have to field off the ice cream request. Now everybody wants ice cream. They're saying in the comments that Riley there.
Thrusters,
but yeah, I like eating a different type of ice cream every time. I go to the grocery store and I look in it and it's like, ooh, let me try that. So I'm into the variety. But this is
Steve, can I make one more comment that
absolutely
might be useful for ending? It's sort of my magic wand thing is to get folks to get to therapy earlier rather than later. I think people don't always think that they'll benefit, but we can grade things and really create a challenge for people. And the earlier, the better. And that can be hard for folks to see. So I just wanted to throw that in there and thank you.
I love it. Some great tips. And so if any last minute comments, but I think Sonia, what do you think? Did this meet your expectations?
Yes, thank you, Steve.
You guys crushed it. You guys crushed it. Look, it's a message of hope, and it's a reminder to folks out there that there's a community built around everyone here to help. Our job is always to restore function, not try to recover it. And that's the difference between doing something late and doing something early. So get to it, meet your local therapist, speech, PTOT, they're all amazing rock stars. If you need orders, just reach out to us and go get some ice cream. Here's my 4-year-old with her giant cone of sprinkles from the other
Holy
day.
cow, that
I
cone's
know.
almost as big as her, and it matches her dress.
It's as big as her head. Yes. Life is beautiful, everybody. If you don't believe that, you got to work with your doc and your team to remind you of that, because it really is. Go enjoy summer, everybody. Thank you, everybody, for joining us for this. This was a blast.
Thanks.